Hi everyone, it's Erie County Executive Mark Polenkars with our daily Facebook Live briefing, town hall meeting for the public. Media members as well as members of the public can ask us questions going through my Facebook Live site, as well as we'll do, of course, a presentation on some of the latest facts with regards to the COVID-19 outbreak here in Erie County. Pleased to be joined once again by, of course, our Dr. Gail Burstein, the Commissioner of Health of the Department of Health, as well as Kendra from Deaf Access Services over my shoulder. And it is National Doctors Day. I want to give a big shout out to all the doctors out there, including this one, for all the work that they're doing. But to all healthcare professionals, thank you. You are the front lines of what we're dealing with here in our region as well as across the world. I know it's some very difficult conditions in many places, including our friends in New York City. And I just want to say a big thank you to you for all that you're doing to save lives in our community as well as in our country. As usual, little proviso that the information that is being provided is only as valid as when it was included in the PowerPoint presentation, which of course changes a lot. So I just wanted you to know that. And with that, I'll turn it over to Dr. Burstein to talk about the cases, deaths, recoveries, and other factors.
So good afternoon. So as of today at 12 p.m., I'm going to be talking about the cases that we've been reported to us in Erie County. So there have been so far a total of 443 positive cases reported to us in Erie County. Among those, unfortunately, 8 have died, and we want to reach out to the family members and loved ones of those who had died and just provide our condolences. There have been, on the good news, there have been 43 people who have recovered officially. There are 392 people who are currently in isolation. And as of last evening, there were 90 individuals who are hospitalized in local hospitals. Next. So, again, we still want people to make sure to self-monitor. And that would be to monitor for a temperature of 100.4 or greater and either cough or shortness of breath. Speaking to my colleagues and my healthcare provider colleagues in the community, I know that there are many people that end up being tested as COVID positive that don't have a fever or don't have the typical symptoms of COVID-19. Those individuals may present with sweats and chills even though they don't have a fever. They may feel very fatigued or exhausted, and then also reported loss of sense of smell or taste. So again, we have to assume that there can be anybody out there that is COVID-19 positive that doesn't actually fit with the symptoms that we're seeing that have been formally classified as typical. So again, that's why it's really important for everybody to maintain good social distancing practices, stay away from other people as much as you can, especially if they look sick. If you don't feel right, even if you don't have a fever, please isolate yourself. Keep yourself away from other people's in the house and other people in the community. It's really important to keep our numbers down, and that's the only way we're going to achieve that. So again, if you develop any of these symptoms, stay at home, isolate yourself. And that means that if you live in a household with other people, have people bring you food, leave it at your door, and then put the dishes out when you're done. Everything goes in and out. Laundry in a bag goes into the washing machine, and then comes to you outside your door. If you have your own bathroom, please use that. If you don't have access to your own bathroom, please get some disinfectant, wipe it up after every time you use it. If you don't feel comfortable that you can maintain, you need some information or you need to figure out if you need to be seen, call your healthcare provider. Don't go there. Many times you can get all the information you need to take care of yourself through just a phone call. If you feel that you need to be seen in an emergency department or an urgent care center, call ahead. If you call 911, let them know that you're sick with symptoms of potential COVID-19 so that they can prepare so you don't expose all our healthcare workers that are so valuable right now and other people in the emergency department. So just want to remind people that so far there is no approved vaccine. There is no approved treatment for COVID-19, so please don't go to the pharmacy and buy something that they say is as FDA approved for COVID-19 treatment. Medicines have good side effects and bad side effects. And if you take a medicine for its good side effects and it hasn't proven to have any good side effects, you might only get the bad side effects. So medicines can be very, very dangerous. That's why they have to go through the FDA approval process. So, even like an antibiotic, that we see the most severe adverse reactions of drugs, just like simple like amoxicillin. So just be very, very careful with what you take. And also, don't be caught by scam. There's a lot of scamming out there on the internet that said they have FDA approved rapid tests for home use, for home self-collection. All the testing that has been approved by the FDA is on their website. And so you can go to the FDA's website and do a search on approved tests for COVID-19. I'll have listed all of them up there. And so far, there really aren't any like rapid home collection, home delivery tests. So just be careful. And if you have any questions about anything medical, about your health, including about COVID-19, call your healthcare provider. So some good news with this is our pharmacies have been great partners. And right now, all the major chains in the state, including in our community, are going to offer a free delivery service to help people stay away from the pharmacy where people have been going who are sick to get treatment. So again, take advantage of that, again, to help with the social distancing. If you need medication from the pharmacy, if you have a prescription or even over-the-counter medication, call your pharmacy and you can pay for it with your credit card over the phone and be able to avoid those lines and get that delivered right to your house.
Thank you, Doctor. Of course, we've been actively involved in the response to COVID-19 in so many ways. I just don't have enough time to talk about it here. There are a lot of partners that have been involved, from our emergency services, our Department of Public Works, the Sheriff's Office, to even our folks associated with economic development, as we're putting together an economic task force. And we had a briefing on that earlier today, and hope we'll be able to announce something in the next 24 hours. I'm expecting a report back from our folks by the end of today. But there's a lot going on. One of the things that we've really been active in is trying to get assistance to our healthcare providers with PPEs, personal protective equipment. I was on the phone a lot last week, as well as emails to the state on our requests. We have a system called New York Responds in New York State, in which we actually enter through a system that's controlled by New York State our needs. We did receive yesterday personal protective equipment. We received thousands of masks, face shields, gloves, gowns, and under the agreement we had with New York State, the first 50% of that was distributed this morning to our three healthcare, our hospital providers, Kaleida Health, Catholic Health, as well as ECMC, Erie County Medical Center, and they got the first 50%. But as you see here, the next 25 SNF is nursing home facilities. Senior nursing home facilities would be getting the next 25%. First responders would get 15%, and then other healthcare providers get 10%. So there's a lot of questions. Are we giving these out to the public? Can we give them to other organizations? And the answer is no. Under the agreement we have with New York State, these go first to and only to healthcare providers based on the percentage that you see. The first 50% was delivered to hospitals today. We know that this will not be enough to get us through like the next few weeks, so we're working on obtaining additional deliveries from New York State right now. We are hopeful, considering we were able to get out so rapidly, I should say, the initial shipment. We should be able to get some more fairly soon. This is not the shipment we talked about last week, in which we put in an order for 400,000 N95 masks at a cost of $1.1 million to be delivered in 50,000 batches. We are expecting the first delivery of that to be on April 10th. We'd hoped it was sooner, but these are actually coming from an overseas manufacturer in Taiwan that has prior approval from the CDC's Neosha division, so these are not fly-by-night masks. These are ones that actually have been previously approved by the CDC at the N95 level by Neosha. And because those are in such scarce demand, we are getting them right from one of the manufacturers. It's taking a little longer than we would think. This just goes to show why we shouldn't be outsourcing so many different supplies, including medical supplies, across the world, because when you have a pandemic and the entire world's fighting for them, it makes it tougher for you to get them. But we do have those coming. But the ones we received yesterday that were partially distributed out earlier are going to healthcare providers. If you are a healthcare provider, you have to respond with our emergency services department, putting in requests in. If you haven't put a request in, you're not going to be part of the initial delivery. So that's why hospitals knew what to do. A lot of nursing homes we contacted told them they had to put the requests in. If you didn't put a request in, you're not going to be part of the initial delivery. You should contact our emergency services department. So all the nursing units, they know they have emergency managers. They should contact our emergency services department. We're working as best as we can to get as many of these personal protective equipment pieces out as fast as possible to us. It's not easy because the demand is everywhere. I've been on the phone lately. Last night I was commiserating with some county executives from across the country. I was talking to a friend of mine in Arizona, another one in Texas. I was communicating with other county executives in New York State, and we are all in the same boat. We are literally in this together. We're in this together with the fight against the coronavirus and COVID-19, and we're in this together with regards to the response. It's not like anyone is hoarding masks or has a greater supply than anyone else. We're all in the same boat, and we all have to act accordingly. So, while we know there's great demand out there, we're doing the best we can to get as much as we can as fast as possible. And I'm glad we were able to get this because I know not every community in the United States has been able to get the personal protective equipment that they wanted. A lot of people are at home and not doing much. And I understand you get a little cabin fever, but there is something you can do that's very important. We need you to complete your census form. You should have received in the mail an invitation from the Census Bureau to complete the 2020 census. I was very happy to see the report last week that showed that Erie County was actually above the state and national average for response, but we know that there's still many people out there who have not responded. So it's very important that you complete your census. We get money from the federal government based on our population. We have representation in Congress that's based on our population. If people are not responding to the census, then we lose money in the long run and we lose representation. And the great thing about the census this year is you can respond online. I did mine online. You see the address up there? It's 2020census.gov, 2020census.gov. You can go there, take the invitation you got in the mail. You'll have a specific code number that is just for your household. You put it in, it takes about 10 minutes, you answer the questions, and you're done. And then you don't have to worry about a census taker walking up to your door, knocking on your door a month from now or so forth. You're done. So get it done. Get your census done. It helps us out tremendously. It assists us in so many different ways. We receive money for our senior programming based on our census numbers. We receive money for our community development programs based on our census numbers. There are so many programs that are dependent upon our population. The more population we have, the more funds we get from the federal government. And we want to ensure that everyone is counted. Everyone that lives in Erie County needs to be counted. You can do that at 2020census.gov. It's available in multiple languages. So if you don't speak English or the household doesn't speak English, you can go through other languages as well. But please, make sure you get your census done while you're home. If you're looking for something to do, take you no more than 10 or 15 minutes and you'll get your census done and you'll help everyone else. Very important program is WIC, Women, Infant, and Children. It is run through Catholic Charities. We've had a lot of people that are in need of assistance that have never needed it before because they've been laid off from a job and they don't know where to turn. WIC, of course, is a program that helps new mothers and their children get the food and other supplies that they need. You can apply online, but you can also call 218-1484 through Catholic Charities to apply for WIC. Once again, it's a federal nutrition program for pregnant, postpartum, and breastfeeding women and infant children up to 5. A lot of newly unemployed individuals are looking for assistance, don't know where to turn, and WIC is a program that might be able to help you out. So if you have not thought about it, you should think about applying for WIC. Parents, grandparents, foster children, legal guardians of a child under 5 can apply, so you just don't have to be the mother per se, but we want you to know that WIC is out there. And while we've been talking about a lot of programs, we hadn't talked about WIC before, so if you are in need of help, especially for a child getting proper nutrition, make certain that you apply for WIC. We have, of course, our COVID-19 call center. If you have a general question about county services or other services in your community, call 211. Do not call the COVID-19 call center about garbage pickup, about what park is open, the best trail to walk on. Call 211. If you got a question about our Parks Department, you can call our Parks Department. If you have a question about our seniors, call our senior services at 858-8526. But if you got a specific question about COVID-19, health-related, you can call our call center at 858-2929. It's open from 8 a.m. to 8 p.m. each day. Once again, that's 858-2929. Depending on when you call, you can get answered immediately, or there may be a little wait. We've seen spurts, and I guarantee you, once we're done with this Facebook Live, it will be busy down there, and then it slows down. If you can wait till the evening, it's usually a little slower in the evening, but if you do have a legitimate health-related question, call 858-2929, and our call center representatives will be there to answer for you. There's lots of information, of course, you can get online at our erie.gov/COVID-19 website. You can go to coronavirus.gov, the federal government CDC site. Lots of good information's online. If you have the ability, and you're probably watching this on Facebook, so you probably do have the ability to go online, get online, check it out. A lot of your questions that you have probably could be answered before you even call. Of course, the COVID-19 number, once again, and webpage at erie.gov/COVID-19. We're here to help. We want people to understand that we know this is a stressful time. Fear and anxiety is normal. We're getting a lot of people who are calling into the COVID-19 hotline who are just fearful. And that's a legitimate issue. We understand it, and we're never going to denigrate anyone or criticize anyone for having anxiety about what's going on. It is a scary time. As the doctor noted, we had our 8th death in the community in the last 24 hours. We have over 400 cases. In basically a week, we've gone from approximately 60 confirmed cases to over 400. And we know there's many more cases out there. We're going to look at the map right now. And map shows 443 active cases, 443 confirmed cases, 392 of which are active, and of course we also have 43 recovered. We added a new little graph. I'm probably blocking it. Over here you can look at how many new cases per day in the bottom, and that'll be updated. And you can also look at the active cases. So you can see the growth in our community of new cases and active cases. That will, of course, be updated daily. We are not going to be updating it every 10 minutes. There's some people who are wondering, why aren't you constantly updating it? Well, first off, we have to get confirmation of the confirmed new cases. The individuals have to be notified that they have COVID-19. Our epidemiologists are still doing contact tracing for these individuals, talking to their close family members or other individuals that they've been in contact with. We are not going out there and saying where everyone's been. We have a lot of people saying, why aren't you doing that? Because I want to know where COVID-19 is in our community. And the answer is, it's everywhere. I don't know how many times I have to affirm this. It's everywhere. It's everywhere in Western New York. Every Western New York county has a case. It's in Southern Ontario. It's my understanding there's only one county that still does not have a confirmed case in New York State. We know it's in Pennsylvania. It's in Erie, Pennsylvania. It's in Cleveland. It's everywhere. To try to hide from it, you can't. Unless you live under a rock for the next 6 months, you're not going to be able to avoid it in some way because it's out there. And that brings me up to a subject matter that I've been seeing over the last 48 hours, which is a little disconcerting, which is people who are saying we need to shut Erie County down from anyone else and prevent people from coming into our community, especially from New York City. I'm disappointed in seeing that because, folks, COVID-19 is already here. And New York City is going through a really rough patch. and we need to support our fellow New Yorkers. If we were going in the same situation that New York City is, do you think we'd want to hear from people downstate or elsewhere in New York that the Buffalonians shouldn't be allowed to go anywhere? They should just be locked there and never allowed to leave? Well, if people are coming from New York City, we certainly hope that they're healthy. We certainly hope that they will get any aid if they are not healthy, but we are not going to shut down our community and basically put barricades up preventing people from coming into Erie County. That's just not going to happen. So to the people who've been posting that on social media or calling our call center saying, I need to basically block the thruway, and people are saying that, or we need to stop people from driving in or flying in, that's not going to happen. We are doing our best in a very difficult situation, but we are not going to create martial law where we're just putting up walls and preventing every person from entering or exiting Erie County. I hope people understand that. We got a great team working hard in Erie County government with our partners in New York State government. I want to thank Governor Cuomo and his team. One of the reasons why we were able to get those PPEs is because we've been working very hard with his staff to get those PPEs here. Thank you to his team, to local government. We actually have a conference call later today with some of our local government representatives to give them an update on what's happening. I thank them for their good work. But the only way we are going to get through this as a county, as a region, as a state, as a country, and for that matter as a binational region, is if we're in this together. Creating walls and saying we're going to shut down ourselves from the rest of the world probably isn't going to work because COVID-19 is already here. We're getting PPEs from Taiwan. We're getting other stuff from other parts of New York State. We are all in this together, and we have to follow the rules. So if we follow the rules, which will help to prevent against community spread, we can reduce the number of patients that are entering our hospitals. We can reduce the number of deaths. It's already here, and if you're going to try to pretend that it's not here and it'll just go away because you don't want people from outside the area to come here, it's too late. It's here, and we're all in it together. That's what we're doing. We're working together as a team here in Erie County with our partners, and we need you to be part of that team, to follow the rules to prevent the further spread of COVID-19 in our community. We can do it. I'm glad to see it seems over the last couple days that people are really taking this seriously now. Maybe it's because there have been deaths, but people are really seem to be taking it seriously. Less people on the roads, less people out, and I thank you because that is how we are going to defeat this together. We will work hard together. We will persevere together to get through this crisis, and I thank each and every one of you for doing that. With that, we'll open up to some questions, and we have a microphone over for Peter Anderson, so you should easily be able to hear him. I know some of the other people could not, but Peter, first question.
Thanks, County Executive. The first question is for Dr. Burstein. Dr. Burstein, is it known, are you immune after having had COVID-19?
Well, I think it's not a done deal. However, Dr. Anthony Fauci has suggested he believes that there will be protective immunity after COVID-19 infection. I think the science still has to completely confirm that, but that's what our expectation is for now. However, that does not mean that it is safe to get infected now and get it over with to get protection. We know that this can be a very, very serious illness for many people, even for young people. So still, people have to practice these precautions like social distancing or physical distancing, hand washing, keeping the frequently touched surfaces clean. So we're hoping and we believe so far that it could be a fully protective immunity. However, we really need more experience and more studies done to completely confirm that.
All right, another question for you, Dr. Burstein. A lot of people are asking about, is it chloroquine with the azithromycin pack, the Z-Pack, the anti-malarial drugs that have been so talked about? Do you know anything more about these? Will they be made available in Erie County?
So the question is, I know that there has been discussion on the media about different recipes of pharmaceuticals that could possibly treat COVID-19. There are some trials occurring right now to look at the effectiveness and safety of different pharmaceuticals, and including some that were just mentioned. However, nothing is FDA approved yet. We're not sure about the safety. We're not sure about the effectiveness. And so until we have medicine that has been proven to be safe and effective to treat COVID-19, I strongly discourage anybody for taking anything off-label. Again, every medicine has good side effects and bad side effects, and if you take some medicine and it doesn't have good side effects, all you'll have is the bad side effects. Azithromycin can cause some pretty serious side effects. Chloroquine can also cause some pretty serious side effects. They're not completely benign medication. That's why they're not over-the-counter. That's why they're prescription only. So I really want to caution people against using this off-label because it could have some pretty bad, serious side effects and may not impart any type of protective effect.
All right, here's a question for the county executive. This past weekend, 2 local establishments were open against the executive order from the governor and had people in having drinks and food. A lot of people are seeing private parties, large gatherings, even speakeasies being opened, and they're wondering how do they report these sorts of things when they see them?
If you are aware of a bar or a restaurant that's operating in contravention of the governor's orders, the pause order, which allows them to do takeout or delivery but not in a location service, you can call our COVID-19 hotline at 858-2929 because that information will be shared with our sanitarians from the Department of Health, which then go out with the sheriff's officers or other law enforcement personnel from the towns or cities, wherever it may be. We've gotten a lot of tips. Yesterday we sent someone out with regards to a tip, and it turned out by the time they got there was no one at the location. There may have been earlier. But we are vigilant. If there are bars and restaurants that are operating in violation of the law, we'll shut you down. And you really don't want to do that. We have a commissioner's order that can shut you down. However, it's up to the state liquor authority to make determination as to whether or not you're going to stay in business. I know the first offense alone can be just a $10,000 fine, but it could also result in the loss of your liquor license. And you might think, well, I can maybe skirt the rules. I have a little speakeasy where some people are allowed into the back room. You make maybe $1,000 that night, but you can get hit with a $10,000 fine and you could lose your liquor license. Is it really worth it? Of course not, because you're actually putting your employees and your patrons at risk. We've read the stories about locations across this country where people had parties or they went to an event and one person had it, and the next thing you know, almost every person at the event had it. The same thing can happen with these bars and restaurants. You don't know if somebody has COVID-19 or not. And even if you're just standing across the bar from somewhere, if somebody has COVID-19 and coughs, that could be transmitted to you standing right across the bar. Or if they give you a bottle of beer, whatever it is, and they've got COVID-19 virus on their hands and they put it on the beer bottle and you touch it, you could get it too. So there's a reason why they're shut down. And if we find out, we will shut you down if you're still operating.
Also with when our hotline may not be open and you're aware, you want to inform somebody about these restaurants that are operating illegally or bars, you can call your local police department. Actually, through the governor's office, local police departments do have the authority to shut them down with environmental health or even without our environmental health staff. So the police department is also a good route to report this, especially when our hotline is closed.
Okay, a question for Dr. Burstein. Doctor, what are your recommendations about face masks when in public?
So with face masks can protect individuals. They are a strategy for harm reduction. So they will, the surgical face masks that many of us have or have access to are not complete protection, unlike the N95 masks that are medically fitted and have a respirator to filter out bacteria and viruses coming in. The regular procedure masks or surgical masks don't have that. However, they are partially protective, and so that could be a strategy for individuals to reduce their risk of contracting COVID-19 when they go out in public. So again, it's a matter of harm reduction. It won't completely reduce your risk. It's part of the tools that we have, including hand washing and social distancing and keeping our environment clean, staying away from sick people. So it's just one of the tools that we have to keep ourselves well and keep our numbers down.
Okay, a question for the county executive, excuse me, about food supply shortage and the food chain. Have you heard any news, county executive, about shortages or other crimps in the food chain for our supermarkets?
I have not heard of any shortages. There occasionally may be an item or two that'll be out in the supermarket. Yesterday, actually, I spent a good portion of my day at home catching up on things, including lots of wash and grocery shopping. And I went to a local grocer in which it wasn't that busy during the middle of the day, and pretty much everything was in stock. There was even toilet paper there. They were a little short on pasta and different types of prepared meals, sort of like the meals that you buy in the box and you prepare at home. But generally everything was there at the grocer. And what we're hearing from the various grocery store chains is that they are getting supplies. There's no reduction in everything. The milk was there, bread was there, eggs were there, orange juice, all the staples. Cereal aisle was full. The delicatessen was full. There may be times in which you go in and something gets picked out because people are buying so much of this particular amount, but there's really no reason for it. And we've got no reports of mass shortages, not only regionally but in the country. So we just ask people to act appropriate when you go shopping. Buy what you need. Especially on perishables, it's silly to buy more than what you need and then you have to throw it out because it just rots. So buy what you need, buy what's appropriate for you and your family, and I don't see any reason why there won't be more of it there the next time you go shopping.
Another question for you, county executive. There seems to still be confusion on essential and non-essential businesses, particularly the construction business and landscaping.
We are going by what is provided by Empire State Development. Let me see if I can find Empire State Development. There's a lot of questions. The easiest way to answer this is to go to the website, folks. People keep on asking us what to do, and we send them to the website, and they're like, I don't know what to do. Well, read the website because it generally is there. You can seek exemptions. Exemptions are available for many different types of businesses, but not all. Empire State Development. And you'll see right here information on novel coronavirus. Information. Here we go. The executive order and the guidance. You click down, you find the guidance, and it lists everything that is determined to be essential. Now, we've heard that there may be some exemptions out there that were granted by other departments. That may be the case, but you have to confirm that with New York State. Just had a request as to whether a pool installer is essential. And based on our review of it, the answer is no. So anybody who was told I got to go to work because I got to install some pools, you are not essential like almost all construction is. There's very limited construction that's still essential. That would only be construction associated with what are really serious, large governmental projects, road, bridges, things like that. You can finish to make safe a construction site, but you can't necessarily finish the project. But all the information is on the website at Empire State Development. If you want an exemption, you can apply through Empire State Development, and they are also taking phone calls through Empire State Development. But it is not our decision-making in county government as to what's essential. People are saying, why are you stopping this? And the answer is, I'm not stopping it. Erie County's not. New York State has. And it's the only way we're going to stop community spread is by reducing the number of people who are intermingling in public. So if you are looking for more answers, just go to the web. It has all the answers, and you will find it there. And if there are questions, you should call Empire State Development. Or if you're wanting to file for an exemption, you should also file through Empire State Development.
Okay, a question for Dr. Burstein. Doctor, it is good to see that people are recovering from coronavirus. What is the definition of recovery, and how do you know when it's happened?
So that's a great question. So what the New York State Health Department is defining as recovery, where people can return to work, is having starting with 7 days after the onset of illness, and then the last 3 of those days has to be fever-free and people feeling better, starting to feel better with the other symptoms. So again, at least 7 days after the onset of illness, and then the last 3 days of your illness have to be fever-free without taking any Tylenol, and your other symptoms feeling better. After that, essential workers can return to work. They have to wear a mask for the next 7 days just to make sure that they don't infect other people. And that's what we're calling as full recovery, is having those full 7 days and the last 3 being fever-free.
Along that same line, doctor, another question. I have had all the symptoms in the past week, but not all at the same time. Does this mean I could have had it? Should I contact my doctor?
So, again, what we're seeing with the spectrum of COVID-19 is a variety of symptoms. Sometimes people never develop a fever. Sometimes people may not develop, any significant symptoms. So it's because the most common things are common. We say in medicine that it's that individual probably had COVID-19 and should behave like they had COVID-19. And so, again, stay in isolation till the person has been at least 7 days after the onset of illness, and the last 3 of those days has been at least 3 days where the person has been fever-free and also starting to feel better with the other symptoms. And then again, for the next 7 days, wear a mask when you're around other people.
And if I can add, the one thing that we're seeing too is that there's a lot of people who look like they would have COVID-19 and we test them and it comes back negative. And we're hearing that from doctors' offices that are doing testing. We're hearing that from the hospitals, that the people they thought would be the prime case of COVID-19 are not. And there are other respiratory illnesses out there that they can have and to be tested and possibly have one of those. But so just because you have a fever and a cough doesn't necessarily mean you have COVID-19, because a lot of people that we've tested that meet those parameters do not have it. So it's tough to say.
Right, but then also they have another infectious disease that's causing a fever, so we don't want that either. So, just kind of some basic common sense. However, you should still contact your healthcare provider by phone. We have heard as our county executives from our community providers that sometimes people with a fever may not have anything infectious at all. It could be a first presentation of something else like an autoimmune disease or some other than an infectious disease. So it's still always good to talk to your healthcare provider if you have questions and say you have a fever and it's persisting and it's you can't shake it. I mean, that's a good time to talk to your healthcare provider.
Thank you. Peter Anderson stepped away. We have the pride of Chautauqua County, Derek Smith here. Derek, what do we have?
All right, County Executive. So we have a resident who says that they live close to Chestnut Ridge Park, but when they went there the last time, it was very full. Very full. Is it still safe for them to drive far away to another park that's farther away from their home?
We certainly want people to get out when they can to enjoy the great outdoors, and it is safe to go in your car and to drive out to another park, but we once again ask you not to be close to other people. Keep at least 6 feet distant. Chestnut Ridge has been busy over the last couple of weeks, while some of the other parks have been very, very quiet. We're glad to hear that people are looking at other alternatives. On our website, our Twitter pages, Facebook, you can find the Erie County Parks Department, and they've been highlighting the different parks that we have. And it was great to see that the Sun newspaper just recently ran, here's a different park you might not have thought of about Emery Park. And there's some great hiking trails there. And Emery Park has beautiful waterfalls. I mean, the Eternal Flame waterfall is really cool in Chestnut Ridge, because where else can you see a flame behind a waterfall? But that trail has been very busy, and we're recommending people go to other places. Emery Park has beautiful waterfalls. Sprague Brook is a great place with these wonderful hiking trails. Try to find a different park. Go somewhere different. Franklin Gulf is an undeveloped natural recreation area that we have in the town of North Collins and in Eden, and it's gorgeous. Some absolutely gorgeous landscapes. You don't even realize you're in Erie County. You might think you're in the Adirondacks. And people don't know they exist. Get out there, enjoy your parks, and don't go to the same ones. But it's okay to get in your car to go for a ride and then go for a hike. Just don't do it with other people that you haven't been around, because they could have the disease and you would potentially catch it.
All right, this next question is for the doctor. If stores are out of hand sanitizer, disinfectant, soap, is there anywhere else that they can turn to buy those items? What are some other options?
So we know that, as our county executive said, that the stores are pretty well stocked, and my understanding is they still have a good supply of soap, and there's always good soap and water. It's just in terms of not having access to a hand sanitizer, if that's the case, using some rubbing alcohol might help as a temporary solution. Again, we believe this virus is the cell wall will break with contact with alcohol. So again, rubbing alcohol may work. Again, you want to be careful that people don't consume it. It's not going to help you if you drink it. It helps you if you put it on surfaces. So again, just be prudent. CDC has some good suggestions about hand sanitizer and soap and water on their website, which I highly recommend people read.
How are you doing back there, Kendra?
Good, thank you.
Okay. Couple more questions and then we have to go.
Okay, this one for you, County Executive. With the President's statements yesterday about the travel guidelines being extended through April 30th, or the social distancing guidelines, rather, through April 30th, do you have any updates on local schools and what that means as it pertains to them?
We are going under the assumption internally in Erie County government that this community will still be shut down for the entire month of April. We know that the schools, I think, were till April 20th, but I assume when they're in about a week out from that date, they will be revisiting that and extending it to April 30th. We are not at our peak yet. I'm glad to say we're starting to see a slight reduction in the number of cases over the last couple of days, but I assume it's going to shoot right up again anyway. Because we're not at our peak. We are seeing continued growth in our cases, and as a result, we might not reach our peak till the end of April, early May. We're hopeful it'll happen sooner so we can get on with our lives a lot quicker, but there's a chance that we may be in this situation not only through the entire month of April, but into May as well. I wish I could give a better answer. But I fully expect that as we get closer to the April 20th deadline, in which they said that schools would resume, that if we are continuing to see what we're seeing in the community today, that they would extend that deadline even longer.
All right. This one is just regarding the census. If I recently moved, how can I get my census information to fill it out?
If you did recently move, you can go to 2020census.gov. And you do not have to have your invitation number, but you can put in your address. So if you go to 2020 Census, and let's go to 2020 Census. And you'll see it says shape your future, start here, respond now. And it asks you a few things. Just hit start questionnaire, and if you do, it says where can I find my 12-digit? If you don't have a number, if you don't have a census ID number, click here, and it'll start asking for the collection of information so they know where your address is. So if you have moved and you don't have the invitation in the mail, you can still apply and do the work that you need to through the census. Now the census was sending them to addresses. They were not sending it to people. So that I received talked to the occupant or the household at my address. So the same should happen to you. So if you just moved into it within the last 3 weeks, you probably have it in your stack of mail that's sitting in there. If you move into the new location like the last few days, then you might not have gotten it. But you can still apply online through 2020census.gov and just go through that little form there till you get to I do not have an invitation ID number, and you can still fill in the form and do the census at that point. One more question before we have to go. Derek?
Do
Do we have any more? I'm
No,
sure we have more questions.
we've answered all the questions.
Well, that's good. I'm sure we didn't answer all of them. There'll be people who are upset we didn't answer their question, but one of the problems is there's so many questions that often come in. It's tough to get to every single one. But once again, I just want to thank everyone for the work that they're doing in the community to help prevent community spread. We as a community need to join together, just like our departments and our leaders in county government join together to address COVID-19. We have to do that as a greater community. We have to do that as a region. We have to do that as a state, as a country. I'm talking to other county executives, including last week I was talking to County Executive Kathy Dahlkemper of Erie County, Pennsylvania. We're not that far away, about 90 miles away, so there's a lot of information we need to share so that we understand where they are and they understand where we are. But I just want to thank everyone for working very hard. It's going to be some time still. As I just noted, it could be more than a month before we get through the peak in our community. I'm hoping the peak is quicker and that by preventing community spread, we're able to get out of this quicker with less hospitalizations and, of course, less deaths. It's one of the worst things I've ever had to do is announce the death of an individual, whether it was a snowstorm or whether it was this. I hate doing it because it's something that we hope would be preventable. And we know we can prevent additional deaths if we just follow the guidelines to stop the spread, to do what we need to stay at home and ensure that our community is better for it. So with that, I want to thank you all for what you're doing on behalf of the greater community. We are going to get through this. We will persevere together, and we are all in this together. All as Erie County residents, New Yorkers, we are all in this together. Have a great day, everyone. I hope you have a wonderful night. Until we see you again, be safe. Stay at home, be strong, and we will persevere. Take
Happy
care.
Doctor's Day, fellow doctors.
Happy Doctor's Day.